Welcome, everyone, to the next session, which is Operational and Tactical Considerations for Measuring Access. I'm Lisa Rubenstein from UCLA Medicine and Public Health and RAND, and I'll be moderating. So this session is going to be my brief introduction and then 10 to 15 minute talks. We're hoping that you'll make liberal use of the question box function. Please label your comments clarify. If there are clarifying comments, we'll try to take them between talks. If they're general comments, we'll wait until after all 5 talks. And we're also going to save your comments and analyze them after the workshop. So even if we don't get to every one, we will certainly see them and make use of them. Next. You have 4 exceptional speakers. The focus is going to be on primary care access particularly. Our 4 speakers are engaged in both measurement and improvement. We have Kevin Grumbach from the University of California, San Francisco. He's the chair of the Department of Family and Community Medicine. We have Mary Barton, who is a vice president at the National Committee for Quality Assurance, or NCQA. So we have a perspective on very large-scale integration of organizations for measurement. We have Patrick Romano from the University of California, Davis School of Medicine and Pediatrics as well. And he will be focusing on his extensive experience on real-world access measurement. And Martin Rowland from the University of Cambridge in the United Kingdom, who really brings in sort of a combination of a long history of measuring access, among other things, and integrating it with policy and the results of policy. So this section focuses on access measures, and we might ask, why measure access? Well, without measurement, improvement is just a conversation. So the point of this session is really thinking about access as the basis for improvement. And if we don't measure it well, we're going to address the wrong targets. Access management is something that came into some of the previous sessions. We carried out a stakeholder panel that had veterans and representatives from other very large systems, such as Canada, the United States, CMS, and came up with a set of definitions that separated access management somewhat from access itself, and decided that access management was a set of goals, evaluations, actions, and resources needed to achieve patient-centered healthcare services that maximize access for defined, eligible populations of patients. And optimal access management then was needed to engage patients, providers, and teams in continuous improvement. So access measures then should represent, if they're going to help improvement, they should represent the targets of access management. And I think the fairly broad definition of the panel reflects some of the considerations in the previous discussions. Optimal access then balances considerations of equity, patient preferences, patient needs, provider and staff needs, and value. And I think the panel felt that this balancing idea was particularly challenging and yet absolutely essential. So whose perspective matters when we're talking about this broad picture of access? We know from data that patients care about access to needed advice and help and how promptly it can be gotten. But we also know, as some of the previous speakers have talked about, that representing being able to use their preferences in choosing how to get care is really critical. Providers and teams also care about patient satisfaction, but they also are concerned with delivering needed care that may not be the care the patient thinks is needed. Patient may or may not be aware of all the things they need. And they're also concerned with a healthy workplace environment. And healthcare systems should or are caring about all of the above, but also about how to provide the things that make it possible to actually get access. So things to keep in mind: do we want to measure access opportunities or realized access? What kinds of modalities? What effects do these things have on our ability to measure well? We pointed out that if you don't measure well, you may be really headed in the wrong direction. Whether to include quality of access, whose perspectives to reflect, and then what are the measurement characteristics that are important? Things like reliability, validity, feasibility, and also comprehensiveness, and whether the findings can be put to useful action.